Welcome to the Naturally Healthy Pets Podcast. Let's get to it. Hello and welcome to Dr. Judy Morgan's Naturally Healthy Pets Podcast. I'm your host, Dr. Judy Morgan, and my guest today is Dr. Steve Marsden. This man is brilliant, so listen to what he has to say. Oh my gosh, he has a lot of initials behind his name, but I think he's a naturopathic doctor, an Oriental medicine doctor, a certified veterinary acupuncturist, human acupuncturist, as far as I know. He also lectures for the International Veterinary Acupuncture Society, the AHVMA, which is the Holistic Veterinary Association, and the AVMA, which is the Traditional Association. So that's got to be fun. And numerous other organizations. He's the co-founder of the College of Integrative Veterinary Therapies, which I did not know, and is a director emeritus of the National University of Natural Medicine in Portland, Oregon. He's a contributing author to numerous textbooks and is author of the Manual of Natural Veterinary Medicine with Dr. Susan Wynn and Essential Guide to Chinese Herbal Formulas, published by CIVT. In 2010, Dr. Marsden was named Teacher of the Year by the AHVMA, very prestigious. And in 2009, the Small Animal Veterinarian of the Year by the Canadian Veterinary Medical Association. Holy cow. And he currently divides his time between the Rockies of Southern Alberta and the coast of San Diego, California. Hey, Steve, are you bored? Do you have nothing to do?
Right? How come I can't retire yet? That's the big question, right? So still have to get out there. I don't know. Still got to hustle every day.
I don't think, even if we didn't have to, though, I think that you and I both have that personality of, we'll be sitting, well, I'm already gray haired, but, we'll be sitting here many years from now.
We're both mission driven.
Something like that. I think that's it. And we didn't even have in your bio that you have formulated a lot of herbal formulas for not even just one herbal company, but for many herbal companies that are providing herbal formulas for both people and animals. And that's amazing. Like, you have to be brilliant to do that. I don't do that.
Oh, yeah. I would not put myself in the brilliant category. But
actually, I would. I love conversations with you.
Oh, well, thank you. Well, I mean, so far as the herbs are concerned, I definitely favor formulas that have been around for, a couple of thousand years or several centuries. So those ancient masters, they did my work for me. All I do is find where their work adapts well today. And that's, so there you go.
It's very cool. So today, what we want to talk about is hip dysplasia and cruciate ligament tears using Chinese medicine. And I think this is a huge topic because we hear about cruciate tears so often. It's so common. I've even seen it. It's really, we used to think of it as a big dog problem, but I've even seen it in small dogs. And one of my cats tore a cruciate, which, not very common in cats. But there have been some, and I actually had one. My daughter's dog has had TPLO surgery. So this, for me to talk about this and be able to give people information on what they can do instead of thousands of dollars for surgery, not to mention the whole, your dog is going to be laid up, then they're still going to have arthritis even after surgery. And there's a good chance they're going to blow out the other one within a year.
Right. Yes.
So what do we do instead? First of all, what's the cause of the cruciate tears to begin with? Because I think there's no consensus on that even.
Right. Well, I would say that the main problem is a circulatory issue. So the and actually if you think back to when we went to veterinary college, they probably told you, if they told me, because they're both the same generation, well, I think they even tell them that now, that you can't heal these ligaments up because they don't have a good enough blood supply. So that made me always think that these were relatively avascular structures. So one day I was poking around the internet just looking at micrographs of torn ligaments, and there's blood all over the place. I mean,
Really?
They're severely hemorrhagic. So the problem is that the blood supply is disorganized and it's not optimized. That's the issue, which is entirely different than not having blood vessels at all.
And because that's what I was taught in veterinary school, which of course I was there with the dinosaurs, but we were taught that tendons and ligaments, they're not going to heal, surgery to repair them and sew two ends back together isn't going to work because they're not going to heal and it doesn't have the strength. So that's really interesting.
Yeah. So I think, okay, so what is it that kind of, it's not a problem with blood vessels being there. It's a problem with how they're functioning. And so what's the big determination of that? That is determined by and large by how we eat, first of all. And that might sound like news that somehow how you eat can regulate how your blood vessels function. But just think about hypertension in people. That's a perfect example of people not eating great diets and then ending up with these kind of constricted vessels as a result. People think of hypertension for themselves as like a sodium issue, and sodium can definitely aggravate the situation, but it's primarily the glycemic load and the glycemic index of their food. And the more that you're living kind of high off the hog in terms of easy calories, abundant calories, the more your body goes into easy inflammation mode. And one of the ways that it makes inflammation easy is by damaging the blood supply or making the blood supply abnormal. Back, if you had asked us or asked our teachers back when you were in vet school, so what stops inflammation? Because everyone knew that chronic inflammation is the issue, right? We've always known that.
Right.
So if you'd asked them, you'd say, well, so when does inflammation go away? Before the 90s, they would have said, well, it just kind of fizzles. Whatever caused it, once that thing's removed, and it kind of just fizzles like a dying campfire. But that's not. Inflammation has to be actively turned off. They actually have a word for it. It's called active resolution. And that active resolution is mediated by blood vessels. In other words, when I say active resolution, what I really mean is a bunch of vascular events, like the blood vessels don't leak anymore and they dilate and they grow and they just kind of reorganize themselves. Those things, those leaky vessels and fewer vessels and constricted vessels are deliberately created by the body during a state of chronic inflammation, and that's mediated by diet. So it's an unhappy thing, but in humans, we get hypertension, we get heart attacks. In dogs, we get osteoarthritis. In humans, we get osteoarthritis. So any chronic inflammation anywhere is mediated by this process. So that's what the issue is. Okay. It's rocket science. It comes down to food, which is your favorite topic.
It comes down to food. All right, Steve. So you brought up food. We all know that, what we put in the body is what drives the engine, for better or for worse. So, these very rich diets that cause, and sugar-based diets basically cause so much inflammation and problems for people. And apparently that's also contributing to what we're seeing in our pets with cruciate tears and tendon ligament issues. So whenever we talk about food, we have to talk about the microbiome. So how do you see chronic joint inflammation being related to the microbiome?
Yeah. Well, this is an unfolding area of research. So it's, I don't even think that they have all the answers yet, but what is certainly clear is that when you have the wrong guys in your microbiome, then they are making metabolites that get absorbed by your system. And especially if you have a leaky gut, but maybe even if you don't, if you just have the wrong bugs fostered by the wrong diet, they make things that then enter your circulation and they go to your joints and create issues. So sometimes these are the byproducts of metabolism. Sometimes these are just antibodies that the body makes against pathogenic microorganisms in the microbiome. And then those antibodies happen to cross-react with joint tissues. So as an example, rheumatoid arthritis in people, the role of the microbiome in causing rheumatoid arthritis is very, very clear. There's no doubt about it. So we would expect that the same thing is probably going to end up being true for some of our animal osteoarthritic conditions. And, and this idea of circulation it might be kind of seeming like it's coming out of left field and does that really pass the smell test? But when you think about Chinese medicine, I mean, anybody who's gone to a really skilled Chinese medical practitioner, what do? Right? They check your pulse. So right from the get-go, in fact, even in those classics that written 2,000 years ago, they literally said it's malpractice not to do Chinese medicine without checking the pulse. They're literally saying this. Yeah, they're saying circulation's at the heart of it all. It's at the heart of everything. And if you ignore it, number one, you might not get things better. Number two, you might make things worse. Most side effects that I see from natural supplements, and even from drugs, are circulatory in nature. They're just a clash. An animal has, well, let's take an example, a dog with chronic arthritis. And people are told, okay, give Metacam every single day. Don't miss a day. Does that dog ever get over its osteoarthritis? No. And the vet says, well, that's because it's chronic inflammation. It's never going to go away. So we're just going to try to dull it, essentially. But if
it's chronic inflammation, we're giving it anti-inflammatory, but it's never going to go away.
Right. So that
makes perfect sense.
Yes. I mean, it was Einstein that said, if you keep doing the same thing over and over and expect different results, that's the definition of insanity. So when people start to feed their animals differently using whole foods, meat and vegetable diets, and they maybe use some herbs to kind of support normal circulation, then and they are able to kind of go to on an as needed basis with these NSAID drugs, they see their dog's joints starting to heal. So that's really the recipe for, and that's true for cruciates, is true for hip dysplasia. And you think, really, hip dysplasia? Maybe that doesn't pass the smell test either, right? But because we've seen X-rays, and the joints are all kind of the shallow acetabular, shallow hip sockets. Yeah. And you think, okay, so how is that a circulatory issue? Well, they did a study, it's probably several decades ago now, and they said that the first event in hip dysplasia is that this ligament that holds the hip into the socket gets inflamed. If that gets inflamed, then all that bony, sloppiness starts to be relevant. But if that ligament is not inflamed and strained, then the femur stays in the acetabulum and the dog does not become clinical. So it is possible to take a dog whose ligament has actually ruptured and their femur is displaced and to treat them, and the body will reattach the ligament and heal it, and the joint will stabilize. So we don't have any idea that these things are possible because conventional medicine never steps outside of itself. It's always anti-inflammatories or surgery, anti-inflammatories or surgery, and kibble, right? So they will never see any other therapeutic possibility because they never don't do those things. But as soon as we sort of step outside of that, then you can see what the body is actually capable of. And these things are true for people as they are for animals. People can heal their cruciates if they're partial tears. Of course, the downside.
It's really interesting because if you get a surgical consult, what are you going to get? You need surgery. I mean, What does a surgeon do? They they send you to surgery. So, all right, Steve, I'm going to break you off right there. We're going to take a break to hear from our sponsor. And when we come back, we're going to talk about some herbal formulas and how they can help, and more of this thinking outside the box. Stay tuned.
I'm excited to tell you about Raised Right. They're a family-owned, human-grade pet food company that works with veterinarian Dr. Karen Becker to make gently cooked, whole food recipes that are high in protein and low in carbohydrates. We feel good recommending Raised Right because their adult dog recipes are complete and balanced through using only whole foods without having to add any synthetic vitamins or minerals. And most of their recipes have less than 2% carbs. That and their recipes are so simple, many having only 10 ingredients or less. Our dogs and cats absolutely love Raised Right. Order yours today by going to raisedrightpets.com/Dr. Judy. That's spelled RAISEDRIGHTPETS.com/DRJUDY. Raised Right is raising the bar on high-quality whole food nutrition for your pets.
Welcome back. You're listening to Naturally Healthy Pets podcast. I'm your host, Dr. Judy Morgan. My guest today is Dr. Steve Marsden, a brilliant acupuncturist, herbalist, veterinarian. He does so many things. So, Steve, we're talking about how chronic joint inflammation really has so much to do with inflammation and circulation, and how we're just not getting good circulation of, I mean, when we think about what is the purpose of the circulatory system, yes, it brings oxygen that we need for breathing, but it's also bringing nutrients and white blood cells that repair and help regenerate tissue and bring the nutrients to the tissue. So obviously, if we don't have good circulation in the tendons, the ligaments, the joint, whatever, then we're not bringing in all the nutrients that are needed for those tissues to survive and repair, right?
Yes. And we have another problem too, which is, besides not having a great supply of oxygen and nutrients, like you were saying, these vessels, when they're malfunctioning because of the food, they leak. So if normally they're supposed to be sealed shut, but the cells start to pull apart. As the cells pull apart, then white blood cells can kind of get through those cracks and into the joint tissues. And then once they're there, they just do what white blood cells do, which is just like, take a flamethrower to that place. So we need to actually close those gaps up. When we do that, number one, white blood cells can't get into the tissue anymore, not unnecessarily. And number two, when you ever, you remember in chemistry class, and they would have those vacuums that are hooked up to the taps, and that when you turned on the tap in your chemistry lab, then it would create a suction. Do you remember that? Did that ever happen in your chemistry class?
Yep.
So that's what happens in joint tissues as well. If you seal these vessels up and things start to flow properly, and a side effect of that is all this inflammatory debris gets sucked out of the interstitium, sucked out of the joints. The white blood cells get sucked away. The free radicals get sucked away. Edema gets sucked away. All that stuff drains. But as long as those vessels are leaking, there's no drainage. So this sealing of things up the leakiness is called endothelial dysfunction. Endothelium is just these cells in the vessels. And when they're dysfunctional, that means that they're just not sealed up properly. So we don't have drugs that fix that. There isn't a drug that fixes that. They've tried, but there isn't a drug that fixes that. But what has been found in the past 30 years is that the acupuncture you use and the herbs you use and that I use, that's how they're working. In other words, there are plenty of substances and plenty of things that can do that sealing effect. They're just not drugs. So lots of herbs, a lot of physical modalities like acupuncture, laser therapy, et cetera, CC loops. They have this influence on the vasculature that is missing from surgery and is missing from modern medicine. So, and diet, most of all, sets the stage for these vessels starting to function properly. But diet takes a while to kick in. So you want your dog to be better right away, right? So how are you going to achieve that? Well, if diet's kicking out over here and your dog is here, how are we going to fill this gap? Think physical therapies. If they're done well, which to my mind means somebody's checking the pulse, somebody's checking how the circulation feels. If they're done well, then that produces oftentimes an immediate benefit, for the first couple of days or something. So then we just have this multi-day or multi-week gap until the diet starts to kick in. So what are we going to fill that in with? We're going to fill that in with herbs and with drugs if necessary, right? We don't want to rip the rug out from under animals and have them be in crippling pain until these other things kick in. But we should start to check in each day. I mean, do you take Advil every single day? Even if you took Advil one day, would you just automatically take it the next day? Or do you wait to see how you feel?
No, but that is this is the problem with it's a problem with the veterinary and the medical industry, because it is so true. If you go to your doctor or if you take your pet to your veterinarian and they are diagnosed with arthritis, you are given an anti-inflammatory prescription and told to take it every day, no matter what. Like, nobody ever checks in to see, are we better? Are we worse? Do we still need that? Do we need the same amount? Do we need to add to that? Do we need to take away from that? And that's absolutely, unfortunately, the way medicine has just turned into this sort of extension of big pharma, where we just it's like even prescription diets. Here's your prescription for this crap food. You've got to feed this every day for the rest of your pet's life. So I love this. I mean, this is amazing. And I like the leaky vessel analogy, because I'm pretty sure that most people listening, we've talked about the microbiome and leaky gut so dang much. Like, that is at the forefront of everything. And nobody talks about the leaky vessels. So I love this.
Well, it's hugely important. And, when I talk about drugs and say, we should try to use them as little as possible. Why is that? It's because there's an enzyme that seals up your vessels. The drugs disable the enzyme. So that's aspirin, any immediately plant-derived compound. So willow bark, etc., it disables that enzyme as well that seals things up. So it seems like willow bark's a bad idea, except that the disabling of that enzyme by willow bark is temporary. So it's reversible. And when we look at all the new drugs that have been developed, like Medicam, et cetera, and say, well, so what's so special about these? It's an irreversible damage to that enzyme. So that's important to kind of put an ice pack on the joints, but by irreversibly damaging that enzyme, they always stay in this leaky state. They never get a chance to get out of it. And so the irony is, the more you take an anti-inflammatory drug, the more doomed you are to waking up with inflammation the next day. And the secret to resolving this is to try to use those drugs on an as-needed basis, figure out what else is causing this, and then also put things in place that can kind of take away some pain, but without necessarily damaging that enzyme further. So give the body a chance to recover. And so that's where the herbs come in.
Very cool. Very cool. So do you have specific herbs, or do you just put together all these combinations of things?
Right. Well, so let's talk about a cruciate for a second. There are three kind of broad classes of herbs that we might use to heal a cruciate ligament. So the first is the most important, is one that counteracts this leaky vessel thing, this endothelial dysfunction. It must do that. So the one that I found works the best, they're all derivatives of a formula that's 2,000 years old called minor bupleurum. So when we use minor bupleurum specifically, we counteract that endothelial dysfunction. we are somewhat anti-inflammatory. So we do kind of take away some of what the drug is doing, but not by crippling that enzyme. We do it in a different way. So that's the first thing, is to kind of counteract leaky vessels and do something else for the dog that kills the pain besides just always, jumping on top of that one enzyme and keeping it so debilitated that they can never recover. Then there's a couple of other formulas or approaches you can layer in if needed. So in humans, to heal a cruciate, what they do now are so-called platelet grafts. So let's imagine that your cruciate is kind of pulled partially apart and there's a gap right here. What they will do is they'll go ahead and they'll put a bunch of platelets into that little cleft. And those platelets cause the collagen fibers to knit together. In other words, what is actually causing the problem? Why is the cruciate so hard to heal? It's not because it doesn't have blood. There's tons of blood. The problem is it's the only ligament in the knee where the platelets get washed away by the joint fluid. All the other ligaments are protected. If they get torn or they strain and platelets rush to the scene to fix it up, the platelets don't get washed away. But the cruciate ligaments, the platelets get washed away. And so that's why they're so hard to heal. So humans have gone ahead and created these grafts. In dogs, all we really have to do is make sure they have more blood. So you can give them so-called blood tonics that basically literally increase the amount of blood flowing through their vasculature so they can deliver more platelets to the scene. And yes, some will get washed away. But if you just keep pushing those platelets in there and keep improving the circulation to pull that off, they will eventually knit those collagen fibers together. So blood tonics, blood movers, and then this initial minor bupleurum formula, that's a recipe for success with cruciates, as long as you're feeding a real food diet. People just can't expect to heal their dog's arthritic problems by feeding kibble or canned food. Yeah.
As I say very often, you cannot out-supplement a bad diet.
No, you can't. You can't out-drug it, and you can't out-surgery it.
That's true. So how long is it going to take for this thing to repair if people, get their pets on? And what if they're already on a raw diet or a whole food diet and they tear a cruciate? Is just adding the herbs and like acupuncture and physical therapy going to be enough?
Yep, usually. I would say that easily 90% of cruciate tears can be healed without surgery. That's a complete obliteration of the ligament through some severe trauma. You might want to just go and get the surgery done for that one. Even so, I've had one or two cases where I've been able to heal that situation up. So it should be assumed that you could heal your dog until proven otherwise. The more that an animal's on a real food diet.
That's interesting because I said my cat blew out his, and his was a trauma. He was outside on New Year's Eve and I didn't know it. And he came in the morning 3-legged. So obviously fireworks, whatever, went off and he probably fell out of a tree or something. And so his was a complete tear. I mean, there was just nothing left of that ligament. And it happened to be right when we were about to move. And so I locked all my cats into one room for about 3 weeks before we moved, because I didn't want to take the chance that one of them would get outside and then, moving day would come and there'd be no cats to be found. So then when we moved, we were in a new neighborhood. I didn't want to let them outside. We were too close to a main road. And so they, again, stayed in a room for about 4 months. And even though his was a complete tear, he got to the point where he was climbing and jumping and running and no lameness. And so he never had surgery as well. He was a raw-fed cat. So even though it was a traumatic complete tear, just with rest and good diet, he still managed to repair himself. So I think a lot of times we're not willing to give them enough time. And certainly if we continue with a crap diet, we're not going to get them where we want them to be anyway.
Yeah. Yeah. You need two things to heal these ligaments up. Besides the tools that we talked about, you need time. So on average, a significant cruciate tear is going to need about 6 months until the dog is clinically normal. There's no medial buttress. The ligament test just as normal on both sides. That can be a 6-month waiting process. And so the other thing you need to make it through 6 months is you need faith that you can pull it off, and most veterinarians don't necessarily have that faith. And so they reach for the TPLOs. Then it's done in 2 or 3 weeks. You're lifted, $10,000 has been lifted from your checking account. Everyone's happy until the next year when the other ligament blows. And they can, I don't remember every ligament on the other side blowing before the advent of TPLO surgeries. I do feel like the surgery, even though people don't necessarily view it that way, it must alter the way animals move and kind of hasten the sort of damage to the opposite side. Because when we used to do those 4-in-1 imbrication techniques and stuff that we learned before TPLOs came along, I don't remember the other side's always blowing. It's only after TPLOs that you can almost count on the other side blowing. But so you need to be able to trust. And it's hard to trust that it's going to heal, because what keeps happening is A, the improvement is slow. And then B, just when it looks like you're getting somewhere, they'll move in some crazy fashion and they'll restrain the ligament and they'll start limping again. And people will assume it's been torn again. There's a period. Actually, what's interesting is to actually heal the ligament up, it takes 2 weeks, 2 to 3 weeks until this cleft is closed. So what's with the 6 months? The 6 months is these collagen fibers, they're all kind of poorly organized and they don't have any tensile strength. And so the knee has not a lot of stability and they step on it wrong. They're chasing a squirrel, they're jumping off the deck, whatever. And it puts new strain on these delicate fibers. And there's a little resurgence of inflammation and pain. And people on the outside, we think, oh, damn, we're never going to, am I allowed to say that? Darn it, we're never going to be able to heal this ligament up.
Right.
But it is actually healed. It's just going through this prolonged phase of remodeling. And this remodeling phase is marked by gradual improvement, re-injury, gradual improvement, re-injury, gradual improvement, re-injury. That's what takes the 6 months. But it's necessary.
Got it.
For that ligament to eventually have all the tensile forces in all the different directions and planes that it needs it in order to, so the dog doesn't re-injure itself. And the cool thing is that whole time you're fixing this injured leg, you're fixing the other ligament as well. So they don't blow on the other side if you can take the time to conservatively heal this side. Now I'm saying 6 months. Sometimes it's faster. Rarely is it longer than 6 months. So it's, but
no, I would agree.
Yeah. So there needs to be a certain amount of faith. Sometimes that's hard to do when your veterinarian is not versed in these ideas and is just judging you all the time. So I appreciate the fact that it's difficult, but you'll save yourself $20,000. Isn't it worth 6 months? Like it's, and your dog is not,
I think
your dog is not crippled in pain. They're living their life. They seem to be aware after a few weeks, they seem to be aware that the knee is more stable. And so even though they're limping and toe touching and not fully weight bearing, they're also happy. And their confidence returns because they can sense the stability. It's just a little uncomfortable. So we need to kind of follow their lead.
Yep. Totally worth it. So good diet, herbs, physical therapy, acupuncture, chiropractic, all those things. We are out of time. I could listen to you all day long. So we didn't go in depth, but Steve formulated formulations for gold standard herbs. And so there's some great gold standard herb products that would be worth looking at. And Steve does have a website called AskDrSteveDVM.com. So you can go there and get more information. Steve, thank you so much. You are just brilliant wealth of knowledge. I appreciate everything you do. And you just need to keep putting more educational information out there for everyone because it's all up here.
Thank you. And thanks for giving me the opportunity to do that. I wanted to mention that for those of you that are watching this video for the next month, after you see this, people can buy the most crucial formula for fixing this problem, which is called Voltrex, Voltrex, from goldstandardherbs.com. They can get a discount on it for the month following this podcast. So if they're like, tell me the name of the formula, for God's sake, it's Voltrex.
Okay, yeah, it's Voltrex.
Yes.
And we have information about it on our website. You can go to Gold Standard, and we will put links in the show notes. Steve, thank you for everything that you do. You are a blessing to pets and pet parents everywhere.
Thank you. Just following your footsteps.
Thanks for listening to another great Naturally Healthy Pets episode. Be sure to check out the show notes for some helpful links. And if you enjoy the show, please be sure to follow and listen for free on your favorite podcast app. We value your feedback and would love to hear from you on how we're doing. Visit drjudymorgan.com for healthy product recommendations, comprehensive courses, upcoming events, and other fantastic resources. Until next time, keep giving your pet the vibrant life they deserve.
The purpose of this podcast is to educate and to inform. It is no substitute for professional care by a veterinarian, licensed nutritionist, or other qualified professional. You're encouraged to do your own research and should not rely on this information as professional medical advice, diagnosis, or treatment. Dr. Judy and her guests express their own views, experience, and conclusions. Dr. Judy Morgan's Naturally Healthy Pets neither endorses or opposes any particular view discussed here.